Hello everyone. Am I audible? Let me know. Let me check. Am I audible? Hello everyone. Our today's topic that is ascending tracks or sensory tracks. I myself Dr. Deepthi Karya. I'm a PhD physiology. I'm a professor and I'm educating MBS and MD students. I have teaching experience of more than 17 years. Let me explain about our subscription within 2 minutes. Here we have two varieties of subscription in on academic. We have one that is plus subscription. Here you can choose the best from the best. You can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank having more than 25,000. You can compete in the live test as well as quiz. And within 12 months, we are coming with a paid note. Second, that is iconic subscription. Here, your access to the best from two, and they are one that is on Academy and Prep Ladder with Academy, and that is on Academy and Prep Ladder with Prep Ladder. All the features of first, that is on Academy and Prep Ladder with Hunt, they are well structured live batches, recorded classes which covers full syllabus, question bank with more than 25,000 questions, competition in live test as well as quiz, comprehensive printed and digital notes. And in second subscription, that is on Academy and Prep Ladder with Prep Ladder, here have clinical and integrated essentials. We have video lectures from the, we have question bank 3, active guidance, system tags, and rapid revision, snapshots, treasures, and 2021 notes. You can subscribe from your mobile. Either you can have plus or iconic. You can use my promo code 10 to get 10% discount. Longer the duration of subscription, cheaper are. So if you are first or second year MBBS student, you can go for long duration. In spite of that, in this channel, we are posting a video. These videos you can access freely. Please note down the name of the channel. So many students may have confusion. Name of the channel that is on Academy Future Doctors. Okay? As well as after this class, I will be available live on special class, and you can access special class that is also free. One of the very important topic we are going to discuss, that pain physiology. Okay? And that is on the special class. For that, what you have to do is you just have to download the app, and in the app you have to write down my name and promo code. You can access the lecture freely either as a live class, or you can access the lecture afterwards. Also, you can watch the lecture at any time. Let us start. So here, first of all, before going in detail about tracks, we must know something about the spinal cord. As you all know, that spinal cord that is located in the vertebral canal, and it extends from foramen magnum. You can see here that here up to the first lumbar vertebra. Here, this lumbar vertebra, okay? And it has dura mater, pia mater, and arachnoid as a covering. Now, in spinal cord, gray matter is inside and white matter is outside. You can see here, this is the cross section of the spinal cord. In the center of the spinal cord, there, there is central canal or spinal canal. Gray matter, as we all know, it consists of cell bodies, and white matter consists of fibers, myelinated and unmyelinated fibers. They form white matter. But the gray matter is inside, and this gray matter forms this gray matter forms H shape. You can see here. It resembles the letter H, and This H has ventral and dorsal gray horns. You can see here, these are ventral gray horn, the dorsal gray horn. These are the, just a minute. Now, next thing is here, lateral horns are also present. Just a minute. Let me check whether any chats are there or not. Then comes lateral horns. These are lateral horns, lateral gray horns. They are present commonly in the areas of thoracic and first lumbar segment, okay, where sympathetic nerves they are. Now, neurons in the gray matter, you can see here, in the gray matters, mainly anterior gray horn has got three varieties, three types of neurons. You can see here this one that is alpha motor. These alpha motor neurons, they are large as well as multiple here, and they leave two anterior roots and they end on the extraphysial fibers, as we have discussed. These are the extraphysial fibers of the muscle, which alpha motor neurons they innervate. Second one that are gamma motor neurons. First alpha, second gamma motor. These gamma motor neurons, these are small as well as scattered cells, and they send axons, the intrafusal fibers. Here you can see muscle has got intra. These are gamma motor. These are, they innervate intrafusal fibers. And third variety of cells in the anterior gray horn, they are Rancho cells. You can see here, these are Rancho cells. These are inhibitory neurons in the lateral gray horn. Here in the lateral gray horn, just just so here you can see. Let me here in the lateral horn. You can see here the lateral horn is prominent from T1 to L2. Neurons in the lateral horn, they give rise to sympathetic preganglionic fibers. This sympathetic preganglionic fibers, although they leave anterior horn here, but these neurons are located here, this in the lateral. Okay. And sorry, in the dorsal horn, there are varieties of neurons. Important one we will just remember, that is substantia gelatinosa of Rolando. This substantia gelatinosa from which and lateral spinothalamic tract they arise, Clark's column cell. We will discuss column cells and chief cells. These three will remember, these are in the dorsal. Now, next is white matter in the spinal cord. White matter you can see here. These are white matter. This is white matter is outside. White matter has got three funiculus. That is anterior white funiculus, this one, lateral white funiculus, and dorsal white funiculus. This funiculus or column both are same. So anterior white funiculus that is present between anterior median fissure. You can see the anterior median and anterior gray horn. This one. Then this is lateral white funiculus, which is present between anterior and posterior gray horn. And dorsal or posterior white funiculus, which is located between, here this is posterior median septum and posterior gray horn. Now, here, this is again you can see this is the cross section of spinal cord having gray matter inside and white matter. This gray matter has got ventral horn, these two are ventral horns, dorsal horns, lateral horns are there here, as well as they have this columns, anterior white column, lateral white column or funiculus, and dorsal white column. Now, tracks in the spinal cord. Here, tracks in the spinal cord. These are short tracks and long tracks. Short tracks are again of two types. Number one, that is association tracks. This association tracks, they connect adjacent segments of the spinal cord. Or in the brain also we have this kind of tracks. So they connect adjacent segments of the spinal cord on the same side. Okay? That is one. Second is commissural tracks. They connect opposite halves of the same segment. They are commissural. This are. So they connect with the opposite side. This cross. Okay? And long tracks, they connect spinal cord with other parts of the. They are ascending tracks and descending tracks. Okay, ascending tracks, these are the tracks that carry impulses from spinal cord spinal cord to brain upward. And descending tracks, they connect or they carry impulses from brain to the spinal cord. Okay? Now, today we'll discuss about ascending tracks. Now, ascending tracks, these are the tracks which carry impulses from spinal cord to brain, ascend. Okay. Therefore, they are also known as sensory tracks. These tracks are, we are just first enumerating all the tracks. First, that is tracks in the dorsal white column. You can see here, these are. This side you can see here, left side here, all ascending tracks are, right side descending tracks are. Okay. So here, left side, we will discuss here. So tracks in the dorsal column, they are, one is fasciculus gracilis, this one. Then fasciculus cuneus. Tracks in the anterior white column is only one mainly. The other are there, anterior spinothalamic tract. Then tracks in the lateral white column is here. One that is lateral spinothalamic tract, this. Then dorsal and ventral spinocerebellar tracts. Other small tracts are also present and they are spinotactal tract. You can see here, spinal cord to the midbrain tactum. Then spinoreticular tract here, spinal cord to the reticular formation. Then spino-olivary tract, that is spinal cord to the inferior olivary nucleus. And spino-vestibular tracts, these are lateral and medial here, this is vestibular nucleus. So spino-vestibular tracts. Now, starting with ventral spinothalamic tract, you can see here, these are located in the anterior white funiculum, these tracts. Okay. Now, these tracts, they have most of the tracts, they have first order neuron, and that is DRG, dorsal root ganglion. What is it? This ganglion means collection of cell bodies outside the CNS, outside. Okay. And it is located near dorsal root. So it is as this one, this is dorsal root ganglion. So this is first order neuron. Okay. This tracks first order neurons, they are dorsal root ganglion. Then next is, afterwards, you see this first order neuron. Right? Now, you can see here, this is our dorsal root ganglion. This one, first order. Okay. This first order neuron, they reach the chief sensory cells here. They are located in the dorsal horn of the spinal cord. And this first order neurons, they end here. From this dorsal dorsal gray horn, we have second order neuron. This second order neuron, sometimes this neuron may ascend or descend for 2 3 segments, or sometimes this neuron crosses to the opposite side immediately. Always remember that in each and every track, second order neuron crosses. Okay? You can see here. This is your second order neuron. So it crosses. And the name suggests this is ventral spinothalamic tract. So these fibers, they reach in the ventral or anterior white funiculus. Okay? And now they ascend up. Okay? They ascend up to thalamus. They pass through medulla, pons, brain, and reaches to the thalamus. And in the thalamus, this second order neuron end. In the nucleus of thalamus, name of the nucleus, that is ventral posterolateral nucleus of thalamus. You try to remember the name, ventral posterolateral of thalamus. Okay? Here, these neurons, they end, and from which third order neurons they arise. These third order neurons, they pass to thalamus and they end in the sensory cortex. So in each and every tract, we have three order neurons. So basically remember first that is dorsal root ganglion, second one that ascends, reaches to the thalamus and third order neuron, they end at the sensory cortex. Now, the important thing is some of the collaterals from these tracts they are given to the reticular formation and therefore if when these tracts are stimulated that results in arousal because reticular formation is concerned with arousal. Functions functions of these tracts are concerned with uh, they carry sensation of crude touch, tickling and itching. Crude touch, tickling and itch. And if there is lesion, bilateral lesion of this tract, both the side, all the sensations are lost. If there is unilateral lesion, because these tracts they cross, what happens? Crude touch, tickling, and itching sensation of opposite side they lost because of crossing of this tract. Okay? Now, next is lateral spinothalamic tract. The name itself suggests lateral is they are located in the lateral white funicular here. Now, the location we have discussed. Then origin. These tract fibers also they originate from dorsal root ganglion. Sorry, just is all. So they arise from here. You can see dorsal root ganglion here. Okay? And these neurons, these first order neurons, they end here in the dorsal horn of the spinal cord, and here they end in the substantia gelatinosa of Rolando. Okay? Here. So this is first order neuron. They end here. From this substantia gelatinosa of Rolando, second order neurons they start. Now they cross. As I told you, always second order neurons they cross. So they cross, they reach to the opposite side, they ascend up to thalamus, they end in the ventral posterolateral of thalamus, and from here, third order neurons they arise. They end in the sensory cortex. So most of the pathway remains same. Only difference is here. This track is located in the lateral white column. Okay. Now, here important thing, the same thing here. This is the pathway of the track, first order neuron, the second, then thalamus, third order. Now, here important thing is here. This you can see here. This is lateral spinal thalamus. So in lower limb or lumbar segments, sacral and lumbar segment fibers, you can see here, they enter first in this tract because they are from lower limb. So you can see here, this is for lumbar. Then as we ascend up, then sacral, then comes thoracic, then comes cervical. So here what happens, lateral most fibers are from sacral region, then from lumbar, then from thoracic and then from cervical. These fibers are represented cervical to sacral segment from medial to lateral. Now, here, functions of these tracts. Functions are they carry sensation of pain and temperature from opposite side and temperature. So what happens if there is bilateral section of this tract, both the sides pain and temperature sensations are lost. And if there is unilateral lesion, then opposite side pain, and suppose you can see here lesion is here. So what happens? This fibers are so opposite side pain and temperature are lost. Now another thing here which I have forgotten that this tract along with here, this one is ventral spinothalamic. Same way lateral spinothalamic and ventral they combinedly they form your spinal lemniscus. In the brain, this anterior and lateral spinothalamic tract, brainstem, they form spinal lemniscus. Okay, now next thing is these tracts also they give collaterals to reticular formation. You see here collaterals given to the reticular formation. So here one another clinical aspect is anterolateral chordotomy. What is the significance of this collaterals? Because suppose somebody is sleeping, and if you are giving painful stimulus, so what happens? This tract gets activated. And when this tract gets activated, along with stimulation of this tract, reticular formation is also stimulated because collaterals are given. The person will arouse, the person wakes up. So this is the clinical significance. One second is if somebody is having pain, then also because this tract gets activated, reticular formation also gets activated, so person cannot sleep. And another clinical aspect here, that is anterolateral cordotomy. So this is the procedure which is performed in which anterior lateral horn of the spinal cord, they are cut. That is to relieve severe pain of carcinoma. Because if the person is in the last stage of carcinoma, pain is not been relieved by any means, then you can do this the procedure, that is anterolateral cordotomy, that is required to be performed. Now, next is spinocerebellar tract. The spinocerebellar tracts are this dorsal and ventral. The dorsal and the ventral spinocerebellar tracts. They are present in the lateral white funiculum. Okay? Now, this let us start with ventral spinocerebellar tracts. These are ventral spinocerebellar. Here you can see this one, green one is ventral spinocerebellar tract. Just follow this green one. Now, location, this tracts, voice is breaking. Okay, I'll try to manage. I'll speak slowly. That am I audible now? Let me know. Mad student. Am I audible? Now. So here, this is ventral spinocerebellar tracts. These are this one. Located in the lateral white funiculum. Okay, okay. We'll continue. So this is located in lateral white funiculum. These are. Okay. Now, origin. This tracts first order neurons, as we have discussed, they are from dorsal root ganglion. This first order neuron, they originate from dorsal root ganglion. Again, you just stress this green one. They end here in the marginal cells of the dorsal, that is lateral most cells. They are known as marginal cells, the dorsal. Okay? Now, and from here, second order neurons start. This is dotted is the neuron. And this tract, they appear only in the L3 to L5 region of the spinal cord. So they carry from lower limb. Now, here is, you can see, first order neuron we have discussed. This green one, trace this green, dorsal root ganglion. Then second order neuron from marginal cells. This marginal cells. Now, this second order neuron, some of the fibers they cross, majority they cross, and small amount they will not. Okay? You can see here this green one, this fibers they cross, they reach on the opposite side lateral white funicle. Now they ascend up two different spinal segment, medulla, pons, midbrain, and they reach to the cerebellum. And through superior cerebellar peduncle, you can see here this tract again they cross here and they terminate in the anterior lobe of the cerebellum. So you can see here cerebellum has got same side control. You can see here this and this side. Am I clear? Okay. Now, functions of these tracts are they carry unconscious or subconscious kinesthetic sensation. Kinesthetic means joint position and joint movement. So unconsciously, whatever joint movements we are performing, that is controlled by spinocerebellar tract. Okay. Now, which are the effects of lesion if these tracts they are damaged? So what happens? This unconscious kinesthetic sensations are lost, and that results in ataxia. Ataxia means lack of coordination. This is known as cerebellar ataxia. Then next is dorsal spinocerebellar tract, which is also known as Flechsing's tract. You can see here this violet color. This one are dorsal spinocerebellar. located same in the lateral funiculus, originating from dorsal root ganglion. And this tract appears in cervical and thoracic segments 7 to 6 segments. Now, we'll discuss about situation, extent, and termination of this tract. So, as some of the things are similar to this ventral spinocerebellar tract, you can see first order neuron, this violet one, just follow this violet one. So, dorsal root ganglion, then this fibers they end. These fibers here they end in the Clark's column cell, from which second order neurons they start, and these second order neurons they will not cross here. They immediately directly enters, sorry, in the lateral white funiculus of the spinal cord, and they ascend up through medulla pons, and here you can see at the level of inferior cerebellar peduncle they do not reach up to superior. This is superior one. They enter in the cerebellum. Okay, which are the functions of this tracks? This track also they carry unconscious kinesthetic function, and if there is lesion in this track that results in loss of kinesthetic sensation from same side. So again you can see here these are various tracks. You can see here this your dorsal spinocerebellar tract number 1 here. You can see same side they ascend. Okay, and ventral spinocerebellar tract anterior green one. You can see here they cross 2 times here, times crossing. Okay. Now small tracts we'll discuss. They are spinotactal tracts. Spinotactal tracts they correspond. They are the component of anterior spinothalamic tract. Here you can see these are spinotactal tracts. They are also located in the lateral white funiculus. They originate from chief sensory cells. First order neurons are dorsal root ganglion, then second order neuron from chief sensory cells, and they cross midline. They terminate in the tectum, that is superior colliculus. And their function is because superior colliculus are concerned with the visual reflexes. Tract carries the function of spino-visual reflex. Then next comes your tract of Leger. This is also one of the important tract, or it is also known as fasciculus dorsolateral. This tract has unique feature that is made up of first order neuron only. How you can see here, this fibers from dorsal root ganglion. This is the part of lateral spinothalamic tract. First order neurons from dorsal root ganglion. Now, these fibers they ascend or descend, and then they enter in the dorsal horn, from which second order neurons they arise. So, this fibers, those who are ascending or descending, they form tract, that is tract of Leger. So, the functions are same, that they carry pain and temperature sensation. They are the part of lateral spinothalamic tract. Okay. Then comes spinoreticular tracts. These are also formed by second order neurons located in the lateral white funiculus, originated from, these are reticular, so they originate from intermediolateral column. They cross the midline and end in the reticular formation. Functions, they are concerned with the arousal as well as alertness and consciousness. Next, spino-olivary tract. These are also located in the anterior and lateral white funiculus. Origin is not specific. Termination in the olivary nucleus of the medulla, and their functions are concerned with the proprioception, sense of position, joint position. Okay. Same way, spino-vestibular tracts are also located in the lateral white funiculus. You can see here these are spino. This is vestibulospinal. These are nuclei, vestibular nuclei. So spino-vestibular tract, they are ascending, these are descending. Okay? They originate from the spinal cord of all the segments, then they are terminated in the lateral vestibular. They also are concerned with the functions of proprioception. Then last two tracts, they are fasciculus gracilis and fasciculus cuneatus. They are located in the dorsal white column. You can see now. So here, location as I told you, posterior funiculus or dorsal white column. Originating from dorsal root ganglion. You can see here same thing. Only difference here is This tract in the spinal cord, they consist of first order neurons. You can see here, these are your dorsal root ganglion from which first order neurons they arise. And after entering in the spinal cord, directly they enter, you can see here this blue one, this enter directly in the dorsal horn. And from dorsal horn, they enter into the dorsal white funiculus. They start now. Fasciculus gracilis contains fibers from the lower extremity. So in the lower limb, we have only fasciculus gracilis. And as we ascend up, fasciculus cuneatus fibers also they join. So what happens here? I'll show you the diagram that becomes easy for you to remember. You can see here fibers from the leg they enter, then from trunk, then from arm, from face. So this way. These are fibers of fasciculus gracilis and these are the fibers of cuneatus. So cuneatus is laterally and gracilis is medially. So fasciculus gracilis contains fibers from the lower limb and cuneatus they contain fiber from the upper limb. Now termination. This tracks they terminate in the medulla oblongata. You can see here the medulla oblongata. These tracks they are terminated. You can see here this in the nuclei, that is nucleus fasciculus and nucleus cuneatus, from which second order neurons they start. And as I told you, second order neurons they cross. So here there is crossing of the neuron, and here these neurons they reach up to thalamus. From thalamus, here again ventral posterolateral nucleus thalamus where these tracks they end, from which third order neurons start and they end in the sensory area. Now, functions of these tracks. These tracks they convey impulses for fine touch, tactile localization, tactile localization, tactile discrimination, vibration. Here important thing is conscious kinesthetic sensation. Kinesthetic means joint movement, sensation and stereognosis. Stereognosis means ability to identify known objects with eyes closed. For example, suppose with eyes closed somebody gives, I can easily identify this is pen. Why? Because my proprioceptors they send signals to the brain and brain identifies that this is pen. So now, and lesion, if there is lesion of this tract, then there is loss of all the sensation, fine touch, tactile localization, tactile discrimination. This is 2 point discrimination, means points are kept separately and identified separately. This is lost. And there is sensory ataxia. Sensory ataxia means uncoordinated, slow, clumsy, voluntary movement. So this is about your your fasciculus gracilis and Q. We are ending here because of lack of time. I'm not discussing questions. Thank you all. Like the video, you can like and you can share the video with your friends and juniors and family member if they are exam going for first MBBS university. Thank you.